Veronica, I'm going to be assessing my patient from head to toe. His name is Mr. Eric. My hands have been washed. My stethoscope has been cleaned with alcoholic swab. My gloves have been worn and I'm ready to go. Hi, my name is Veronica and I will be your nurse today. How are you? I'm going to be conducting a physical examination from head to toe. Is that okay for you? Do you want to use the washroom before we get started? I'm going to provide you with privacy. I'll ask you to state your last name and your date of birth, and I'll cover you with this blanket for comfort. For general appearance, his color is consistent with the rest of the body and he does not have a body odor. He is sitting upright, he has adequate nutrition, his height and weight is consistent with the rest of the body and the body is symmetrical. He is communicating fluently, maintaining good eye contact, well dressed, and has good personal hygiene. He's awake and alert. And can you state where you are, the time, the year, and your name? And he's oriented 3 times. He does not have difficulties breathing, and there's normal rise and fall of the chest. Can you walk to the door? Yes, he has good range of motion and stability. His head is normal cephalic and round, and I don't see any visible scars or lesions present. I'm going to palpate the head for the temperature, which is consistent with the rest of the body. I'm also going to palpate for tenderness or pain, any masses, lumps, or lesions, or fractures, and there is none. The hair is evenly distributed, it's black, fake, and I don't see any signs of lice present. His face is symmetrical, no abnormal facial hair, no abnormal movement of the face. The color is consistent with the rest of the body. I'm going to palpate for the temperature, which is consistent with the rest of the body. I'm also going to palpate for any lumps, any masses, tenderness or pain, or any broken fractures, and there is none. I'm going to test for cranial nerve number 7, which is the facial nerve. I ask the patient to frown, smile, show me your teeth, puff your eyes very tight, puff your cheek, close your eyes very tight that I don't open, raise your eyebrow. Shows that the patient is able to do this symmetrically, which shows that the facial nerve is functional. The eyelashes are symmetrical and evenly distributed. The eyelid is symmetrical, no lid lag or ptosis. The sclera is white and the conjunctiva is pink. I'm going to test for cranial nerve number 3, which is the oculomotor nerve. The pupil appear to be round, 2 millimeters, and equal bilaterally. I'm going to test for direct and light consensual light reflex. When I flash my light on his left eye, the left eye constricts. When I flash the light the second time, the right eye constricts. When I flash my light on the right eye constricts. When I flash it the second time, the left eye constricts. To test for accommodation, please look at the wall, and when I bring my finger closer to your eye, focus on my finger, okay? The eyes converge and the pupil constrict. That shows that the oculomotor nerve is functional. The ears are symmetrical. The color is consistent with the rest of the body. There is no foreign body present. I'm going to palpate the auricles and the tragos for tenderness or pain. Do you feel pains? No. I'm going to conduct a whispering test to test for hearing impairment. Please occlude your left ear. I will go behind you and whisper on your left ear. 1S6. What did I say? And I'm going to go behind your right ear. Please occlude your right ear. I will whisper and you let me know what I said. What did I say? The patient does not show any sign of hearing impairment. The nose is on the midline, no nasal flaring, no crusting, and the color is consistent with the rest of the body. I'm going to palpate for the frontal sinuses and the maxillary sinuses for tenderness. Do you feel pains? No. So there is no sinusitis. The lips appear pink and moist, no bleeding. Can you open your mouth? The gums appear pink and no bleeding. The teeth appear white, 32 in number. I'm going to use a tongue depressor to examine your tongue. It's on the midline and no sign of tongue atrophy. The hard and the soft palate appear pink and intact. I'm going to test for cranial nerve number 9, which is the glossopharyngeal nerve. I'll ask the patient, and cranial nerve number 10, which is the valgus nerve. Please say, ah. The soft palate and the ovular rises, which means that both nerves are functional. I'm going to test for cranial nerve number 12, which is the hypoglossal nerve. And I'll ask you to stick your tongue out, which is on the midline, side to side, roll it from side to side. Say light, tight, dynamite. No tremors observed, which means that the nerve is functional. The neck is on the midline. The head is well seated on the neck. The symmetry of the neck, the color is consistent with the rest of the body. The trachea is on the midline. There is no abnormal inflammation of the thyroid gland. I'm going to palpate the neck for the temperature, which is consistent with the rest of the body. I'm going to palpate for any tenderness or pain, any lumps, any swelling, or any lesions, and there is none. I'm going to palpate the radial pulse for 1 full minute. First on one side and on the other side. It is 68, the strength is 2+, and it's regular on both sides. I'm going to test for spinal accessory nerve, which is cranial nerve number 11. I'll place my hand on your left side and ask you to turn your head to the left against a resistance. Go. And I'm going to place my hand on your right and ask you to turn your head to the right against my resistance. I'll ask you to shrug your shoulders against my resistance. The patient was able to do this, which means with no pain or resistance, with no pains, which shows that the nerve is functional. The symmetry of the upper extremities, the left hand is the same like the right hand. There is even distribution of the hair. The color is consistent with the rest of the body. No sign of diaphoresis. I'm going to palpate for the temperature of the extremities, which is consistent with the rest of the body. I'm going to palpate the joint for tenderness or pain. I'm going to palpate for muscle tone, muscle bulk, for moisture, and for turgor. All appears to be normal. I'm going to assess the radial pulse for 1 full minute bilaterally. That is on both hands. It is 68. The strength is 2+, and it's regular on both sides. Capillary refill is less than 3 seconds, and the nails appear pink. I'm going to test for grip. Please grip my hands very tight as much as you can. It is very strong and regular on both sides. I'm going to test for range of motion. Please flex your fingers and extend. Do inversion and evasion of the fingers, flexion and extension of the wrist, a radial deviation and ulnar radiation, deviation, flexion and extension of the elbow, supination and pronation of the elbow. Shrug your shoulder, adduction away from the midline, adduction towards the midline, internal and external rotation of the shoulder. The patient, while doing this, did not observe any sign of pain, crepitus, or altered range of motion, which means that there's normal range of motion in the upper extremities. The lower extremities appear to be symmetrical. The left leg is the same like the right leg. The hair is evenly distributed. The color is consistent with the rest of the body. No sign of edema observed. I'm going to palpate for temperature, which is consistent with the rest of the body. I'm going to palpate for any tenderness or pain, for joint tenderness or pain, for any masses, for any lumps. I'm also going to feel for muscle tone, for muscle bulk, for moisture, and all appears to be normal. I'm going to palpate the dorsalis pedialis pulse here for 1 full minute on both sides, and I'm going to palpate the posterior tibialis pulse for 1 full minute here. It is 68. The strength is 2+, and it's regular on both sides. If this was my patient's limb, I'll ask him to plantar flex against a resistance and dorsiflex against a resistance. It is strong and regular. Next, I'm going to wash my hands and change my gloves in order to examine the posterior thorax. Please, can you take off your shirt so that I examine your back? Thank you. For the examination of the back, I'm also going to cover you with this blanket. The back appears to be straight, no kyphosis or scoliosis. There's no scars present. The color is consistent with the rest of the body. and the symmetry of the back. I'm going to palpate for the temperature of the back, which appears to be normal. I'm going to palpate for any masses, any lumps, tenderness or pains, for any swellings, and there is none. The transverse ratio, that is side to side, is 2, and the anterior posterior ratio is 1, which is a normal assessment indicating that there is no barrel chest. I'm going to test for chest expansion. So I'm going to grab some adipose tissue and ask you to breathe in and out. When he breathes in, my fingers separate, and when he breathes out, my fingers come back to normal, which shows the normal rise and fall of the chest. I'm going to test for tactile frematus in order to feel for vibration. And when I place my hand on your back, please say 99. 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99. The vibrations were normal. I'm going to use my stethoscope in order to auscultate for the long sounds for 1 full minute. Beginning from the top. The bronchovesicular sounds were heard in the peripheral area. The vesicular sounds were heard in the peripheral area. The bronchovesicular sounds were heard in the middle. The lungs were very clear. The respiration was 16, strong and regular. And I didn't, no abnormal, no crackles or wheezing sounds were heard. Next, I'm going to examine the anterior thorax. And I'll ask you to turn to the front. Thank you. Please don't dress up yet. I'm going to cover you with this blanket again. For the examination of the interior thorax, the test appears to be straight. The symmetry of the chest, the color is consistent with the rest of the body, and there's normal rise and fall of the chest. Respiration is 16 breaths per minute, which is a normal assessment. I'm going to assess for cardiovascular system. I'm going to place my stethoscope for 1 full minute in order to assess the valve sound. First, I will begin with the aortic area, which is located on the second intercostal area to the right. Here, S2 is louder than S1. I'll move my stethoscope to the left intercostal space. On the second intercostal space, which is on the pulmonary valve. Here, S2 is louder than S1. I'll move my stethoscope to the third intercostal space. This is the Elf's point. S1 is the same as S2. I'll move my stethoscope to the fourth intercostal space. Here I'm listening to the tricuspid valve, and S1 is the loudest. I'll move my stethoscope to the fifth intercostal space to the left. Here I'm listening to the heart rate. This is the mitral valve, and the heart rate is normal, is 68, is strong and regular. For the assessment of the abdomen, I didn't hear any murmurs or abnormal heart valve sound heard. Next, I'm going to assess the abdomen in the 4 quadrant. The abdomen is symmetrical. The color is consistent with the rest of the body. The umbilicus is on the midline. No stretch marks. The hair is evenly distributed, and no visible signs of rigidity. I'm going to auscultate using the stethoscope in the four quadrants to listen for the characteristics and the frequency of the vowel sounds, beginning with the right lower quadrant. And then the right upper quadrant, the left lower quadrant, the left lower upper quadrant, and the left lower quadrant. 8 vowel sounds were heard. Normal peristalsis movement of the stomach. Next, I'm going to do light palpation in the 4 quadrant in order to assess for any superficial masses or rigidity or tenderness or pain. So my observation, beginning from the right lower quadrant, then the right upper quadrant, the left upper quadrant, and the left lower quadrant. Do you feel any pains? No. I didn't feel any masses or any sign of rigidity. Next, I'm going to palpate the bladder for any sign of distension. I'm going to drape the patient, and I'll expose only the lower quadrant for the examination. There are no signs of bladder distension and no sign that the bladder is full. Thank you, Mr. Eric, for your cooperation. This ends my examination. Bye.